Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Epiploic foramen as well as the lesser sac. Now let's look at the relations of the epiploic foramen. So this epiploic foramen, anteriorly, what is present? Anteriorly, it is the hepatoduodenal ligament, HD ligament, and this contains the hepatic artery, portal vein, as well as the common bile duct. The next category is, first was anterior, now it is going to be posterior. Posteriorly, there is IVC, there is right suprarenal gland. So there is right suprarenal gland as well as the body. So there is a body of the T12 vertebrae. Then we look at the superior. So superior means it's a caudate lobe. It is caudate lobe, and this caudate lobe is of the liver. And lastly, it is inferior. Inferior stands for the first part of the duodenum. So it's nothing but the first part of the duodenum. So the epiploic foramen, anteriorly the hepatoduodenal ligament, which includes the hepatic artery, portal vein, as well as the common bile duct. Next, posteriorly, there is IVC and the right suprarenal gland, as well as the body of the T12 vertebrae. And superiorly, there is caudate lobe, which caudate lobe of the liver, and inferiorly, there is the first part of the duodenum. Now let's look at the relation with the lesser sac. So in terms of the lesser sac, there is anterior, posterior, superior and inferior. So anterior, it stands for the caudate lobe of the liver. So anteriorly there is caudate. So there is caudate lobe, and this is nothing but of the liver. Next is, it includes the lesser omentum as well as the stomach. So there is lesser omentum. Then there is also the stomach, and also the first two layers of the greater omentum. There is first two layers of the GO, that is a greater omentum. Now let's recap. The lesser omentum anteriorly, the caudate lobe of the liver, the lesser omentum, the stomach, as well as the first two layers of the greater omentum. So posteriorly, what is present? So when you look at posteriorly the structures forming the stomach bed. So what do they include? So the structures forming the stomach bed. So structures which form the stomach bed. This includes the pancreas. So pancreas, the splenic artery. Next, there is also the presence of the there is left kidney, and also the suprarenal gland, the suprarenal. Then comes the commencement of the abdominal aorta. So commencement of the abdominal aorta, as well as the celiac artery. So commencement of the abdominal aorta as well as the presence of the celiac artery. Next is the left crux of the diaphragm. So there is left crux, this is of the diaphragm, and there is also the splenic flexure. So there is splenic flexure. So this splenic flexure is of the colon, and there is also transverse mesocolon. There is transverse mesocolon. So posteriorly, we saw that there is a structures which pass to the stomach bed. That is the pancreas, the splenic artery, the left kidney, the suprarenal glands, and then the common abdominal aorta, the celiac artery. Next, there is the left crux of the diaphragm, the splenic flexure of the colon, as well as the transverse mesocolon. So what is superior to this lesser sac? So superiorly, it involves the reflection of the peritoneum from the esophagus to the diaphragm. So it is nothing but a reflection. So there is a reflection, and this is of the peritoneum. So reflection of the peritoneum, and this is from the esophagus to the diaphragm. So it is from the esophagus to the diaphragm. Then when you move on to the inferior aspect, it is continuous to the second and third layer of the greater omentum. So it is on the second and third layer of the greater omentum, it is continuing. So to recap, the superior is a reflection of the peritoneum, and this is from the esophagus to the diaphragm. Next is the inferior, it contains the 2 to 3 layers of the greater omentum, and this is continued. To learn and grow daily like this, please do subscribe.